Good evening.
Good evening, sir. Good evening. Good evening, everyone. Today, we have selected a very good topic with our very own Dr.Vaishali.A.Bhagat ma'am. And I feel proud to say that she is my teacher also. मैंने उनसे पूरा anatomy सीखा है and she has been a very kind and हमारे लिए सबके लिए बहुत अच्छी favorite teacher मैं बोलूँगी, one of the favorite teachers रही हैं. एंड अभी भी जो स्टूडेंट्स हैं आई थिंक वो उनको बहुत ही शी इज अडोरेबल टीचर टू ऑल. तो अभी भी बहुत प्यार मिलता होगा स्टूडेंट्स का उनको. सो मैम वी वेलकम यू ऑल ओवर हियर. इंटरनेशनल होम्योपैथिक फाउंडेशन वेलकम्स यू. IHF was founded in the year 2015, which aims to promote homeopathy through academics and integrated approach. Since inception, we have organized various free health camps, seminar, homeopathic medical education series. The most talked about 3 days successful International Homeopathic Congress was organized at Taj Vivanta Dwarka in April 2016, where more than 250 doctors, researchers participated globally. Virtual International Homeopathic Summit and mega panel discussions were organized during COVID-19, and there were eminent speakers. You can see on the screen the names of the eminent speakers who had joined this summit and the mega panel discussion. We have proposed the credit system for homeopathic doctors to Ayush department, which is in progress. IHF has also organized a joint webinar with Lung Care Foundation to create awareness in society against increasing pollution and its harmful effects. The management team of IHF is guided by Dr. R.N. Vahi sir, who is the co-founder president, Dr. Muktinder sir, Dr. Amita, myself, Dr. Bhavna, Dr. Monica Singh, Dr. Gurbir Kaur, Dr. Suman, and Dr. Vinod Madan. So today's topic is very important because हमारे पास सबके पास ऐसे patients आते हैं जो कि बहुत mood swings की problems के साथ आते हैं. तो मैम ने ये टॉपिक सेलेक्ट किया because it is a very important topic for all of us. So we welcome you, ma'am. So this is about Dr. Vaishali A. Bhagat, and I would request Dr. Bhavna to introduce Dr. Vaishali ma'am to our audience. Over to you, Dr. Bhavna.
Yeah, good evening, everyone, and welcome, Dr. Vishali. So, for everyone to know, today we have a very learned and a dynamic speaker amongst us, Dr. Vaishali.A.Bhagat. She has 29 years of professional experience as a homeopathic consultant. Currently, she is vice principal and associate professor in anatomy in prestigious Bharati Vidyapeeth, Deemed University, Homeopathic Medical College, and postgraduate Research College, Pune. She is MD Homeopathy in Organon of Medicine and Homeopathic Philosophy from University of Pune, and a PhD scholar from Maharashtra. Her various research papers have been published in reputed journals of homeopathy. She has been a speaker in various international, national, and state level conferences, workshops, and seminars. She is recipient of Best Teacher and Best Technical Award in college. Waiting to Vishal. Over to you. Thank you.
Over to you, ma'am. Just give me a moment that I will share your slide then. Just give me.
आपकी आवाज नहीं आ रही है डॉक्टर अमिता.
हाँ जी मैम, मैं स्लाइड शेयर कर रही हूँ, एक सेकंड बस. अभी आ रही है मेरी आवाज आपको?
हाँ, आ रही है.
हाँ जी मैम, मैं बस स्लाइड शेयर कर रही हूँ.
जैसे कि if you permit me, can I have a break? Vaishali, Amita?
Yes, sir.
I say, can I have a break today? I reached just now, but there are
Yes.
guests
Yes,
Yeah.
sir. Yes, sir. Yes, sir. Please go ahead, sir. I understand, sir.
Thank you.
Thank you, sir. Namaste. Sir.
Ma'am, is this visible to you?
Yes, yes. You can
मैं बस हाँ मैं
full
कर रही
screen
हूँ
color from beginning.
हाँ जी
Yeah. And then you need to click because there are a lot of animations there.
yes ma'am
So shall I begin?
yes ma'am please do and I'll just again make an announcement that अगर किसी का connection बीच में break हो जाता है please वापस से link पे join करें वही link work करेगा thank you ma'am
How many participants have joined? Can I know? And Dr. Amita? Because here I'm not able to see the
28
participants.
28 are there I think most of them will be joining soon क्योंकि सब clinic wind up करके आते हैं
Yes, yes, yes.
हाँ
And
जी
Delhi people are more professional.
yeah.
So do you want me to begin or wait for a few seconds?
नहीं मैम आप start कर दीजिए
So good evening, all of you. And at the outset, I just want to thank Dr. Vahi sir, who's the president and very kind to me always and has given me this opportunity. Also, Dr. Amita Arora, who's been my adorant student right from beginning. And to my surprise, she is doing very good in this International Homeopathic Forum. Uh, I like to pray Saraswati Devi so that she will give me the knowledge to give whatever I'm doing today is for out of her effort only. Also, I pray our most adorable Ganesh ji to begin this webinar and end it without any vigna. So here I am from Pune and giving you a very short and brief of the subject mood swings in female approaching menopause. Can I have the next slide, please? So when we talk about the mood swing, we have mood spectrum. And the mood spectrum varies from psychotic depression, mainly the depression, dysthymia, that is the hot flushes, stable, substratial mania, hypomania, mania, psychotic mania. You need to click, Amita, a little more, 2-3 clicks, so that we have our mood from a lovely, adorable girl to a very worried woman. Next slide. We know the swings, and our swings go from an empty swings to a very beautiful and adorable and lovable, laughable swings. Next. So what are this 7 dwarfs of menopause? At the beginning, the mood swing, when we are talking about menopause, we have something which is itchy, with bitchy, sweaty, sleepy, bloated, forgetful, and all dried up. These are the definitions of women who are at menopause. Next slide. So we have, what is this mood swings? So 70% of women in this suffer from mood swings. They are sudden changes in emotional state, happy, sad, angry, anxious, without a clear reason. Some negative impact on women's quality of life, relationships, work, and performance. So we can see the angry woman, we can see a laughing woman, an anxious woman, and a weeping woman. Next slide. We have the relationship and the quality of life. The scorecard varies from educational, health, infrastructure, recreational environment, our mission, business economics, our full whatever we have to apply subjectively at work, at our relationship, at our home. We are sweaty. Next slide. So what is this? Why it is so? In short, a brief of estrogen. Estrogens in females are produced primarily by ovaries and pregnancy and the placenta. Follicle stimulating hormone stimulates the ovarian production of estrogens by the granulosa cells of the ovarian follicles and corpus luteum. Some estrogens are produced in small amounts by other tissues such as liver, pancreas, bone, adrenal glands, skin, brain, adipose tissue, and breast. The secondary sources of estrogen are especially important in postmenopausal women. The pathway of estrogen biosynthesis in extragonadal tissue is different. These tissues are not able to synthesize the C19 hormone, steroids, and therefore depend on C19 supplies from other tissue and the level erotomadize. Females. Synthesis of estrogen starts in theca internal cells and ovary by the synthesis of androstenedione from cholesterol. Next slide, please. So the effects of estrogen in female is a powerful hormone, and the menopause gives lot of disturbances like lower libido, digestive diseases, mood swings, and the old culprit we can say is the estrogen, which comes from the pituitary gland disease, excessive physical activity, neoplasm, sudden loss of body weight, ovarian dysfunction, taking certain medications, smoking, alcohol consumption, or stress. Next slide. So we have into what is this menopause. Mood swings do vary with menopause. You have to click. We have this, and the whole spectrum of this menopause begins at the process of aging. Ovaries stop producing eggs and hormones, and the ages of this, it varies from 45 to 55, and depending on genetic, environmental, and lifestyle factors. The average menopause in United States lies at 52 years, but in India it ranges from 45 to 55. Next slide. So we have a perimenopausal symptoms, which is actually a transition to menopause. And this gives hot flushes, night sweats, weight gain, insomnia, vaginal dryness, and reduced libido. Next slide. What is the pathophysiology? Factors which contribute mood swings. Now, it's the hormonal. Now, we have known that the drop of estrogen may affect how the body manages serotonin and norepinephrine, two substances that may have link to depression. Additionally, women may experience stress, anxiety, depression, low esteem, fatigue, stress, forgetful, anxiety, and so many things which actually links to estrogen deficiency. Next slide. We have symptomatology, which varies from mood changes to behavioral changes, and we have this high and low feeling in ourselves. We have, usually it is very weird or restless, or some people say that it's very whimsical. The female starts behaving very differently, impulsively, and very risk behavior such as speeding sprees, impulsive sex, and impulsive business investments. Next slide. So woman here is not able to understand what is this, the strategies they undergo with hormonal therapy, the replacement therapy, which is well known, but it also comes with high risk of the hormone therapy. Next slide. They also depend on antidepressants. Now, these antidepressants have a caution of side effects. Though it can prevent mood swings, but it definitely has nausea, headache, weight gain, sexual dysfunction, and all depends on this withdrawal symptoms, too many symptoms. Next slide. So now, what is the cup of the tea? As a homeopath, I can tell you with this so many years of 29 years of experience I'm having with treating many women diseases, the psychotherapy which we give to the females, and believe in me, homeopaths do spend a lot of time in interrogating the woman. She feels better. She feels went out. When we patiently hear her and ask, what next? What next? She gives her analysis of the whole incidents right from her childhood to the recent fights, what she goes in her family, with husband, at workplace with her boss, and her dear friends who were so close to her. But now, with this whimsical behavior, it changes and she is totally in stress and anxiety. Here, the counseling helps. Next slide. So, when we come into our homeopathic approach, this homeopathy will give you and wonder also that when I am finding in a repertory of complete, I have a Zomeo Ultimate Pro, and when I find this complete repertory in mind and the mood changeable and variable, I found 403 remedies. Now this becomes a really very tough practice for a homeopath, while our friends, the contemporary, they have, of course, with all the investigations and due care, they give their hormonal replacement therapy with lot of caution. But here, dear friends, today we are imparting homeopathy. Homeopathy has a lot of efforts into the practice. It takes really a sweat down for a homeopath to find out 403 remedies, marking from 4 marks to 3 marks to 2 marks and 1 marks. And we wonder whether all these remedies have to be by hearted to be found out the symptomatology. And of course, the repertory comes to our um, benefit, and it will tell us the symptomatology of the patient from aconite, bovista, aurum, belladonna, crocus sativa, ferrum, to calcarea, to cannabis indica, to ozone, to naja, to arnica, to dios, to irido, to hypericum, to maybe tautopathy and the organ remedy. Next slide, please. So we are going into the depth of the study to find out how homeopathy has its effect. Let us find out in repertorial totality what rubrics we can take. For example, mind, the climacteric period. We know that menopause is a climacteric period and it's a change of life. The rubrics of mind we take, and we find that there are 105 remedies from aconite, amyl nitricum, argentum nitricum, aurum met, belladonna, cactus, calcarea, semicifuga, colosin, graphitis, ignatia, sepia, manganum, theridium, eustilago, and all these are in our practice regularly. Next slide. Mind weeping, tearful mood, climacteric period in. We find sulfur, zincum, ferrum also. Mind anger, climacteric period in. Soranum comes to our rescue. Mind anxiety, climacteric period in. Amyl nitricum when it comes to palpitation. Calibrom when it comes to vivid symptoms of mind, trillium pendulum when the menstrual has profuse, doesn't stop, comes every 2 or 3 weeks. Mind estranged climacteric period in lachesis comes in forefront. But I have a good cure with Asteria rubens also. When females come with fibroadenoma or with symptoms of estranged in climacteric period. Mind hysteria. These are the symptoms where the patients come and we find ignatia there because it's an alternate, changeable symptoms. Lachesis comes when it is palpitation, hypertension, Pteridon when the female are sensitive, mind insanity, madness. We know the remedy is lachesis. Mind irritability. We know the remedy is semicifuga when there are black clouds overlapping her. Next slide. We have mind restlessness, nervousness, climacteric period in. We have chamomilla, coffea. Valeriana is a very good remedy which works in this period. There is sadness, depression, climacteric period. Natrum carb I have used many times along with sepia and veratrum. Folliculinum is a remedy which is often used to give a stimulus to the ovaries. Mind sensitive, oversensitive, climacteric period in ignatia. Zincum valerina, once I've used this remedy in patient with restlessness and with hysterical symptoms. Next slide. So we have our repertorial where we refer to Kant's Bonninghausen and we see the chapters of female genitalia. We find menopause. We have menses irregular, hot flushes. Bonninghausen will have mind in mind chapter, memory poor, forgetful. In circulation, we can find palpitations and climacteric age. Next slide. We have homeopathic remedies. Now, the therapeutics which are close to mood swings come to capsicum, lachesis. Capsicum suits patients with lax muscle fiber and diminished vital heat. It affects the mucous membrane, a sensation of constriction, burning pains, nausea near the menopause, sleeplessness, worse open air draft uncovering, better while eating. Lachesis is full of symptoms of climacteric age disturbances, where the female goes into suspiciousness, derangement of senses, religious insanity, climacteric problems, including hot flushes with palpitation, hemorrhages, headaches, fainting spells, menses too short and too feeble, left ovary very painful and swollen, breast inflamed, especially when at the beginning and end of the menstruation. This is, I have tried it many times. Lachesis do act especially well at the beginning. Worse at sleep, left side, pressure, constriction around the neck, better appearance of discharges, warm applications. Next slide. Anacardium and glonine are another two remedies which come close to these symptomatology, like nervous disposition, impaired memory, depression, diminution of sense, smell, sight, and taste, fixed ideas with melancholy, absent-minded, leucorrhea with itching, spells of sleeplessness, worse application of hot water, better fasting, lying on side rubbing. Glonine, where there are a lot of congestive headaches, worst exposure to sun, left side, and typically the patient is better by brandy. Next slide. Sepia is our favorite remedy, and it often comes higher up in our repertorial totality, where we find the female with a telltale face, with weakness, yellow complexion, bearing down sensation, and having hot flushes at menopause with weakness and perspiration, upward tendency, easy fainting, one of the most important uterine remedies, tubercular with chronic hepatic problems and with uterine reflexes. Worse forenoons, evenings, washing, dampness, left side after sweat, cold air before thunderstorms. She is always better with exercise, pressure, warmth of bed, hot application, drawing limbs up, cold bathing after sleep. Kappa self comes with a unique, peculiar symptom like profuse perspiration. This is obviously in the climacteric, where the patient will have craving for sour food and strong flavors, itching in nipples, worse during menses, and they will always be sweating but pulling up the blankets around themselves, being chilly and hypersensitive. Next slide. Now, just we will go and see that how different authors have come through the aspect of this climatic diseases. So I always open books of Farooq Master and Clark and so on, and I've just put few slides over here because I find them very interesting. And with the cross reference, when we find out what exactly the author wants to speak of. So when we know that it is a tearful mood, but we have to see the cross reference. What is lamenting? Why she sheds so much tear? Why there is an anguish? Why this is oversensitive and sentimental girl who listens to music just before menses she goes into weep? What are these provocations? Why the diseases are affected, and which are the remedies close to it? So we have Epis, Calcaria, carbs, Causticum, Cicuta, Graphitis, Lycopodium, veratrum, platina, sepia, and sulfur, and so on. Next slide. So we have John H. Clark, and he said about his in the book of his domestic medicine, change of life, what it is, why women are suffering from this phase of the life. Maybe the blood supply has been altered, the heart and blood vessels are affected, patients in flushes of heat followed with perspiration and chills come to us. These are the conditions of some women who scarcely are conscious and of any difference, and other suffers for years and years. But these are really troublesome symptoms. Next slide. Dr. Barnett came with a very interesting sentence. So I just quote him, regards the monthly courses as in a measure depurative when they sees this outlet being closed. Any latent tendency that may have existed previously is likely to be brought to the surface. Not to forget this, when we are taking our history in details, the anamnesis, the long forgetful symptoms of patients they suffered in the childhood, they come up at this phase of their life. So this is, we have to find out these symptomatology, go into these sufferings, detailings in it to find out the constitutional remedy, and not just mingle into the common symptoms of the menopause like palpitation, giddiness, headache, etc. Next. General treatment is often been spoke that we have to be very, very sympathetic to this female. We have to take her mind, her inconveniency, and make whatever the conditions are made worsen have to be noted down. Moreover, it is very important that the constitutional treatment should be followed during this time where there are any morbid tendencies present in family history of a patient. Next slide. So we come to know at this stage that there are few medicines which becomes our favorite, and we do prescribe them every 2 or 3 hours, like Ignatia, Actia racemosa, lachesis, and sulfur. Being very close to the symptomatology of Ignatia, like nervousness, numbness in various parts, sinking, flushing, constipation, sensation as if a ball in the throat. Actia racemosa will always come with complaints of sleeplessness. Lachesis will always come with complaints of worse from sleep, have a neck is very sensitive, melancholic, crying, weeping, jealousy, suspiciousness. Sulfur ranks higher up in the repertorial totality with hotness and sinking sensation at 11 a.m. with hot head and cold feet. Next slide. So I suppose we are just rounded up of the what are the causa occasionalis of this type of females who are very close to menopause and do have mood swings. Let us enter into a case which has come to me during her menopause age, way before at age of 45. And this lady was a very, very haughty woman. I went into her details about her symptomatology. Next slide. And she was a woman of very disciplined, very conscientious, very bold, used to talk a lot about her work, how she was in forefront. Her husband is an army man, and she being a very beautiful girl right from the beginning, and youngest lady in the house, two sisters, elder sister and brother. She was pampered, and she was quite good looking. So she had an early affair, but it broke off. And the boy said that I didn't like her. And she went into suppressed feeling, and she said that how can he cheat on me? And there she went into depression. When she came to me, she had symptoms of mood swings, lot of pain in the stomach, crampy pains in the abdomen, and she used to say that that she cannot urinate properly. Um, if she was used for doing lot of exercises and lot of symptomatology coming up with hot flushes, and she was and these patients, they come already learned, they are like learned, they know everything about menopause, they know everything about mood swings. And they said that I have to get relief, I have to get good sleep, I have to work, I am an HR manager, I have to handle so much of pressure, make me okay. My menses are every 2 3 weeks, I cannot bear this profuse flowing of menstrual with stringy discharges. I am sleepless at night, I just wake up at night with and see that my AC is on, my fan is on. Next slide. So this woman had a past history of recurrent cold and coryza, and she had tonsillitis, history of worm infestations. Her menarche did start early at the 8th, and since then she was unwell. She had a strong family history of cancer tongue in her paternal grandfather, and in maternal grandmother had CA breast. Father was diabetes and mother was obese. Husband is an army, and son 15 years she had a cesarean section. Next slide. Next slide. So this woman came to me with her sonography that she has a fibroid, and this fibroid is causing a lot of trouble to her. All her investigations were normal, though her triglycerides were slightly raised, and she had thyroid TSH raised. So I was I was giving her thyroidinum 1x at that time prior, and she confided to me her story, or the story which I've just told you. The father was very strict. Mother revealed that she cried a lot after the breakup of the boy, and she could not stand him. She said, like, I'm going to see this boy when I grow up, and I'm going to marry a more beautiful man than him. And of course, her husband, army man, tall, dark, handsome, all these things. Next slide. So when she came to me, she had a lot of pain in her lumbar region, and she had burning maturation. There were eruptions on her face. There was hirsutism like symptoms. There was hair fall. She had lot of pruritus vulva, lot of hot flushes, palpitations. She used to have heaviness in leg. And next slide. So her remedy obviously came to platinum. Next slide. I'll just show you the repertorial totality. Recently, the next slide of repertorial totality, we'll go to repertorial totality. Her USD showed an umbilical hernia, and to my surprise, I was that how can such a woman with so much of exercise had this umbilical hernia? It was close to her cesarean section. So obviously at this age, the muscle tone has gone less, and there was a popping up of hernia. But the symptoms carried worries, full of business. She had all the symptoms pointed to sepia. Now sepia is a chilly person. And at this stage, when we found out that she had an erotism with excessive sexual desire, haughty, proud, arrogant, contemptuous, with lot of superiority complex, the remedy came to Platina. The previous slide, Platina showed her lot of difference. A 1M potency was given, and intercurrently thuja was given frequently. The Platina female has the sensation of growing larger in every direction, superiority complex of highest degree, pride and overestimation of oneself, looks down upon others, arrogant, haughty, contemptuous, nymphomania in pubertal state, erotism, vaginismus with spasm, constrictions, premature sexual erotism, excessive development of sex consciousness, sexual instinct, sexual organs in virgins that leads to masturbation before puberty. Sexual organs are exceedingly sensitive, cannot bear even the cloth of napkin to touch the private parts, will go into spasm from an examination. Vulva is very painfully sensitive during births. Violent cramping pains attended with numbness of the parts. Chamomilla, aconite, calmia, though came and were given in her treatment subsequently. When the Platina 1M was given, her pain lessened, her fibroid lessened, and an intercurrent 200 of Thuja was given to lessen her fibroid. Next slide. Next slide. So here we have a small message to all of you that when it comes to mood swings and there are changes approaching women during menopause, we think that mood swings are very common and normal phenomena. But mind you, we have to keep this in mind that it is not a sign of weakness or mental illness. All the patients are put into mental aspect, that there is the female goes whimsical, she's out of the mind. But this is all due to hormonal and psychological changes which occurs. Seeking professional help will give a positive lifestyle changes. And you know Angela Jolie, Michael Obama, Salma Hayek have openly spoke of these experiences with their menopausal symptoms. Homeopath can do wonders here, empathically and with our dynamic infinitesimal doses. We must aim to cure, sometimes to relieve often, but always to comfort, says Osler. Next slide. As we enter into another two cases, I have two cases with the repertorial totality for you today. As going into all the three cases will be a little time consuming and will not be given full justice in this small hour. So I'll just give you the crux of this lady who was a maths teacher and an English medium school with her son affecting with ADHD. A lot of mental disturbances she had right when the boy was born. At her phase of menopause, she turned to me with all these symptoms of anxiety, fear, failure of, irritability of trifles. She, she said, will I have an heart disease? I have so much of palpitation. My blood pressure goes down. She has hypotension instead of hypertension. She always went into blood pressure of 100 systolic and 50 diastolic. Always with anger, sadness, menses before, with suicidal disposition, rudeness, ailments from. She was working in English medium school where her superiors were dominating her. As she was supervisor, a lot of things has to be happen, but she would manage all these things with a lot of zeal. Inflammation, joints, arthritis, all these symptoms gave me a remedy, sepia. And believe me, she was put into a right spirit of taking all the undue pressures in her work aspect and of course home with sepia. A year I followed sepia 0 by 1. Next slide. This case is very interesting. It's a huge case. I would really like to explain this case in depth, and it will take more than an hour. To give you just a crux of this lady, she is not in India now. When she came to me, she was taking treatment for her manic depressive psychosis. At her early age, 35, she came. She was relieved and then she went to USA and now she has again come down after 10 years, 45, with symptoms of mood swings. And these mood swings would wander so much that my remedies, which I have given her from lachesis to veratrum album, I, eh, on the initial aspect, I tried with lachesis, and lachesis soothed her with all her symptomatology of suspicion, her in such a way that she used to feel that her husband, her mother-in-law, is giving poison and she will be killed. Her loquacity, everything matches with lachesis then. Now, recently, when she came revived with this case again, and after a dose of carcinosin, she has been put back to her senses. When she vented, she came to me. When she vented all her symptoms, I gave her carcinosin, waited for a week or so, got a phone call that she's feeling absolutely better with the dose which what was given last, and she could sleep, she could get rid of this symptom that she's been poisoned. So it's a case of constitutional lacusis, but intermittent and anti-miasmatic, which cleared the case. She's still following me. I think that she's been cleared with carcinosin. Next slide. 5 minutes are there with me. So this comes to an end, and I hope that my presentation has brought you an full spectrum. Of course, it's a roller coaster, but a spectrum of mood swing. What happens at the time of menopause. So thank you and gratitude to all my passionate listener. Long live homeopathy.
थैंक यू सो मच मैम, थैंक यू। आपने एक शॉर्ट टाइम में जो इलेबोरेट करके मेडिसिन के बारे में बताया, मोस्टली हम लोग अवेयर होते हैं कि ये इस एज में ये मेडिसिन जो हैं बहुत यूजफुल होती हैं, बट एक डिफरेंशिएशन जो आपने रेमेडीज के बीच में बताया, सो दैट वाज क्वाइट हेल्पफुल। आई रिक्वेस्ट डॉक्टर भावना एंड डॉक्टर मुक्तिंदर सर to kindly take over. If anybody has any queries, please let us know and raise your hand. Dr. Muktinder sir, Dr. Bhavna sir, Dr. Bhavna, over to you.
Okay, I'll take first. I want to thank you, Dr. Vaishali. आपने बहुत अच्छा overview दिया, and I really like that 7 dwarfs वाला आपका example to remember itchy bitchy. So, and right from like repertorial analysis, then the therapeutics, and then cases. So you have covered it really very well. And we would like to, because we do get cases, and homeopathy is a good alternative replacement of hormonal replacement therapy. So if we all know more about this, we can very confidently, take cases and help our patients. Because ये तो होना ही है, any woman, any girl child who is born, ये phase तो आना ही है. So we can very confidently help. Thank you so much. Thank you.
Thank you.
Thank you, Dr. Bhavna. Dr. Muktinder sir.
Yes. First of all, I appreciate the efforts of IHF, and I have listened to Dr. Vaishali for the first time. And if I am right, Dr. Amit has told that you are a teacher or not. Yeah, I remember, if I remember it right.
Yes, sir.
So your approach is really appreciable. And I have also learned that this mood swings and how pathophysiology, and definitely we all are dealing with such cases of menopause. And this is such a topic that every female has to pass through menopause. And our society is not much educated about this topic. Many people, they wonder about here and there, do unnecessary investigations, do unnecessary consultations, and further complicate, because these days, if you go to as a allopaths, so they tend to prescribe a lot, they tend to do a lot of testing, they tend to prescribe a lot of medications. So that further complicates the problems. And I remember that many a times the malnutrition or the metabolic issues in the menopause, they are the real culprits, because as the age is advancing, so that is the stage of female, working female, it is almost a pre-retirement age. And I remember Dr. Amita याद कराना मेरे को, this mid life crisis करके एक syndrome आता है आजकल, that has very similar a lot of similarity to the menopausal syndrome. So we'll do some event on that.
के बाद स्टार्ट होता है, आई थिंक वो मिड लाइफ क्राइसिस का जो आ रहा है आजकल।
तो बहुत सारे लोगों में ये इंटरमिंगल होता है, मिड लाइफ क्राइसिस एंड दिस मेनोपॉजल, प्री मेनोपॉजल, तो फीमेल्स के केसेस में. So we'll do some events on that also. But Dr. Vaishali, I really appreciate the clarity of thoughts, the flow of your presentation, and the takeaway message. So these are the three things which I am really taking back after this lecture. So I congratulate and I really appreciate your efforts. Thank you.
Thank you, sir.
Thank you so much, sir. On behalf of International Homeopathic Foundation, I thank Dr. Mrs. Vaishali.A.Bhagat for her precious time, for educating us and for telling us more about the menopause. I thank all the doctors, students, practitioners who are part of this webinar. I think you will definitely learn something new. You must have got new things to learn from the remedies which actually ma'am has told. So I just want to share one more thing that with the guidance of Professor Dr. Muktinder Singh sir, Dr. Vahi sir and the team of IHF, we are doing Let's Learn Together. ये हमारा campaign चल रहा है and we are blessed that today is the 57th day. Most of the doctors from all over India, even abroad, are contributing. We are learning together. So आप सब भी इसको ज्वाइन कर सकते हैं एंड कंट्रीब्यूट कर सकते हैं अपनी लर्निंग्स या जो भी नॉलेज आप मेडिकल नॉलेज डाइट पे कुछ भी आप शेयर करना चाहें तो प्लीज ihf.webinars@gmail पे आप भेज सकते हैं. आप डॉक्टर गुरबीर को व्हाट्सएप के थ्रू भेज सकते हैं. So in case you have anything good to share, we welcome you all. बस उसमें आप अपना source जरूर डालें कि from which source actually you are taking that, and you can just send us with your name, your contact details. So thank you everyone once again. Thank you ma'am for your time, for your energy. Thank you everyone, and we will be joining again on another good session with you all. Thank you.
Definitely. Thank you so much.
Thank you ma'am. So we can leave the meeting now with your permission.
Yes, yes.
Thank
We
you.
call it closed. Thank you.
Thank you, sir. Thank you, ma'am. Thank you, everyone.